and it is a privilege to be here. I am glad to hear that you had good debriefings and opportunity to be in social settings and just talk. If you didn't have any feelings, as Lisa talked about the Boston Marathon, let me say, let's have a small gathering later. It is the stuff of compassion fatigue. It is what causes pain for the caregiver. Caring for caregivers is a necessity in healthcare. It is something that we have not looked at diligently. There is some research. Our greatest research is with nursing staff. However, physician staff is beginning to be researched across the nation, and we have one study that I was delighted to see that has come out in 2013. Physicians experience compassion fatigue, burnout, or moral distress at a fairly high rate. And that it's particular for emergency physicians, for general internal medicine, and also family physicians. And that's because those three areas get the first patients that need the immediate support. And what can we do? Well, I think that's true for nurses as well, and I'm going to give you some statistics because nursing has been exploring this for a good long time. We need to look at this across the board in research for all disciplines in healthcare, but caregivers in general experience compassion fatigue. Traumatic stress. Have you experienced it? Who has? Yeah. Traumatic stress comes at inopportune times when we least expect it, which requires that we be ready. It is important to note that we do this pre-emergency, pre-crisis, and how we care for ourselves in the day-to-day makes the difference in whether or not we really cope well with that trauma. I think Beth Hudnall-Stamm is one of the best in looking at compassion fatigue, self-care, burnout, and all of those terms, burnout, compassion fatigue, moral distress, all have various nuances. They are not the same thing, but they are very close cousins. Maybe double first cousins. We have those in North Carolina. So it's kind of along those lines. I get it when you are traumatized. I get it now that I've worked in healthcare for nearly 20 years, and a good portion of that in pediatrics. Traumatic stress comes because of the amount of care that we seek to give and the things we can't do. Did it go the right way? There we go. And there is a soul weariness. It is important to note that our souls become tired. Our spirit becomes tired, and you have felt that in the work that you've done. You may not have called it that. You may not have named it that. You may have said, I can't go back in there today. While working at Virginia Commonwealth University in Richmond, Virginia, I had a nurse call in to her nurse manager in the pediatric intensive care unit, and she said, I can't come in today. She was halfway up the walkway into the building, and she paused, and Mary said, that's okay, we'll cover. She said, no, I can't come back. And it was a result of compassion fatigue. She later went into, after recovering herself, she began a program of care for nurses who were experiencing that soul weariness that comes, that makes you feel like, I love what I do, but I don't think I can continue to do it. Well, I'm here to tell you that you can. You can keep doing it. You can love what you love, do what you do, and stay with it, even in the midst of the compassion fatigue. Compassion fatigue is 100% treatable. 100% treatable. Burnout, we often change jobs. We go somewhere else. We maybe just go to a different discipline or to a different unit. Nurses, it's not bad to change jobs. Let me put it that way. It's not bad. I did that. I've done that a couple of times. It's not bad to change jobs, but you need to know why you're doing it. And if it's because it's too painful, let's address it before you go to the next place, because it will follow you. Compassion fatigue is natural, normal. It's something that happens to anyone who is compassionate. Now, if you don't have any compassion in you, most of us aren't created that way, but if you're one of those few that is not compassionate, you are not going to experience compassion fatigue. You might experience burnout, but you won't be compassion fatigued. Compassion fatigue is normal, natural. It happens because of what we choose to do. It is a hazard of the profession of caregiving. And some of the areas of caregiving have more opportunity for you to be compassion fatigued than others. The symptoms are fatigue across the board, mental, emotional, spiritual, and physical, but you also have those moments of sleep disturbance. Anybody not able to sleep lately? Oh, the nights I dream, you think they would be really good, but when I started with my compassion fatigue, which went way too far before I addressed it, now you should say, shame, shame, you're a chaplain, you know better. But I didn't. I just kept doing and doing and doing. That, in fact, somebody just recently said, a Zen Buddhist said, I think that's called pathological altruism. And I thought, I didn't know that altruism could be pathological. But maybe it is if we don't set really good boundaries. Sleep disturbances. I'd call my boss in the middle of the night. I didn't call him at home. I called his number at work, which was, I didn't know, tied to his pager. And so any night, he might get a page in the middle of the night. And one day I said, you know, I call you in the middle of the night. And he said, oh, yeah, I know. But he didn't chastise me about it, but I did figure out I need to wait at least till 5. You know, he didn't sleep much anyway. He bragged about not getting much sleep, but I thought I'm interrupting those 4 hours that he does get. I need to change that. And anxiety. I would be so anxious, and I think, what is that about? Why is there generalized anxiety? I went to all the doctors. We had really good doctors. They said, Ann, there's nothing wrong with you. You can hear. I don't know why you think you're dizzy. I was running into walls. I was parking my car crooked. That's compassion fatigue. My brain was affected. I didn't address it soon enough. PTSD symptomology is manageable. We don't get rid of it. Compassion fatigue symptomology, we can actually prevent it going into PTSD, and should. Anger and depression, all the literature says, I want y'all to know this, reduced appetite, but for me, my appetite has never reduced, and so I just put increased appetite. It's not research-based, but it's experiential. High blood pressure, dizzy, guilty, and just the inability to concentrate. Someone told me the other day she was so stressed, she said, you know, I can't think. And I said, right, that is what happens to us. Whoop, went the wrong way. Compassion fatigue triggers single exposure. Surely 10% of those caregivers in Boston experience compassion fatigue. That's the norm. 10 to 15% of the population will experience compassion fatigue around a mass casualty, around a traumatic event. It can be just one, however, or it can be cumulative. So I work with staff who work in areas where they experience a lot of death and dying. Death and dying that is as kind and peaceful as it can be is better, I think, for the patient, for the family, and for the staff. Traumatic death causes a delay even to get to the grief portion of what's happening with caregivers. Deep trauma, Boston Marathon, the Virginia Tech shootings, the Wake Forest helicopter crash, compassion fatigue, suffering and pain. But there are 2 down here that I want you to think about: poor boundaries and insufficient resources. I can identify why I experience compassion fatigue. I worked with over 700 families whose children died. I buried many of those children. I helped those families to have the funding to bury their children because they didn't have the funds to do that. But I didn't take enough time between each death. I paused, I thought about it, but I didn't take enough time to be sure that I had processed it fully. So I'm very aware that we need help to be able to process. We are all pretty good at our jobs. We're good caregivers. but it's good caregivers, dedicated caregivers that experience compassion fatigue and burnout. And so to be able to say, you know, medicine has taught us to be stoic, to suck it up, go to that next trauma or that next death, because that's what we do, that's who we are, that's what our job is. But it is humanity touching humanity. And so the necessity of reflecting on it is critical for our well-being. And it's going to be more so, I believe, as we continue into healthcare in the future, because we can do more. And sometimes we should, but sometimes we shouldn't. We can address situations that 50 years ago we could not address, 20 years ago we could not address. It brings on more emotional, psychological, and spiritual suffering for caregivers. And then insufficient resources. Compassion satisfaction is what keeps us where we are while we stay with what we do. How many of you feel like you're really pretty good at caregiving? Sure, I want all of you to raise your hands because you're all good. If you don't feel like you're great, you're at least good enough, because patients are getting well, right? Families are being taken care of. And colleagues, you're still able to smile when you walk in the door. You got some satisfaction there. It is that good feeling, that altruistic feeling, I made a difference. When you lose that, when you feel like I'm not making a difference, your compassion satisfaction is kind of low. Now, healthcare providers generally score very high on compassion satisfaction because you love what you do, whatever discipline you're in. That makes it possible for when those tough times come, that you begin to just access those resources within you, the resiliency that you have. I did make a difference with this child, and we made a difference in this child's dying. We made a difference, a good difference. Compassion satisfaction enhances our sense of well-being, and our sense of well-being affects how we care for others. Now, it's my position, and I'd like to get on the national platform and say this somewhere, that unless we take care of our caregivers, our healthcare providers, that our patients will not receive what they need. So institutions are giving some things like paid time off, you have health care, but you know what? Every one of our really high stress units and every one of our low stress units needs chair massage in the unit. 10 minutes of chair massage will reduce your anxiety for 24 hours. If you reduce your anxiety for 24 hours, you reduce the unit's anxiety. And the reduction of unit anxiety reduces the anxiety in a patient's room. We demonstrated at VCU that if we reduce staffing anxiety, they could think better, problem solve better, and we're able to decrease length of stay of pediatric patients. Now, that's pretty significant, and that'll talk to administrators because they want to see that return on investment. We don't want to lose the well-established wisdom caregivers in our institutions. And we were at VCU, we were losing our intensive care nursing staff in pediatrics from 3 years to 10 years. We either had them new to 3 years or 10 and above. We were losing that center section, and we needed to figure out why. And they were compassion fatigued. We were not supporting them psychologically, socially, emotionally, sufficiently. And they weren't taking advantage of what was available to be able to sustain. So they went somewhere else. Occasionally they would come back. The work that we did there was a mind, body, spirit program, and we retained, in the initial study there were 6. We retained all 6 nurses. They thought they were gonna leave. We retained all 6. That's $145,000 per nurse retained for the institution. For the administrators, the money mattered. For the unit, the fact that they went from a blaming culture because they were so fatigued mattered because they moved from blaming to problem solving and feeling empowered. And it was about caring for self. So I'll ask you today some of the things that I think are important about how do you care for yourself with a caveat. Let me tell you about satisfaction. These are the things we want you to have. when you come to work. Joy and happiness and contentment, and there's a balance within your life. The one thing on the research with the physicians, the 2013 research, that I loved was that the vast majority of physicians, so I don't know how many physicians are sitting in here, but they felt, on the whole, that they had sufficient family time, time off, or personal time away from work. And I thought, wow, that is great. If that really does capture physicians in the U.S., that they are working in that 50-hour range. You know, we thought 40 hours was the right number. We still think it, and we'd like it to be 35, but it's really about 50. And so physicians are feeling that they do have that. And I actually want to do that at Wake Forest. So physicians, I'm coming. It'll be good. We're going to see what we can do. We need work-life balance. And then when we really are satisfied, we are creative human beings. We are so creative. We have the capacity to really move mountains, change systems, make it happen, and we're productive. Now, the triggers for compassion satisfaction is being there, being your best, arriving when you're needed. Boston arrived in huge ways when that bombing occurred. They arrived with the skills needed, and it worked, and there was a synergy that happened. Also, satisfaction happens when you help for a good death. A patient doesn't struggle. A family is present. There's a loving presence, and I gotta tell you, the nurses and the physicians, I mean, the chaplains can be there and should be there. Physical therapy, respiratory therapy, all the disciplines, but those families want to see the nurse and they want to see the doctor. And it gives hope to that family even as their child is dying. So when people can make a peaceful transition. 2 cases that I was working with. One, a child who had been, she really had extreme CP all of her life, and she was so loved that she lived a long time. But in her final days, she coded several times, and the family finally said, let's stop. Who she was gone. They wanted to donate, and we had just signed the protocol for donation by cardiac death. It was in the late 90s. So we went to the OR to withdraw support. It was a tough and long death. She had a strong heart. And so the patient had to die in about 90 minutes, and it was probably about 85 minutes before this child died. She did donate, but it was painful for the staff gathered around her and the family. It was painful because it wasn't a gentle going. The same week, a young man died in the pediatric ICU. His family brought in, they were Muslim, and his family brought in a tape for transition. It was incredibly beautiful, and he just transitioned from this world to whatever we don't yet understand. And you could feel the calmness and the peace in the room. So, you know, stress is catching. It's like a cold. If you've got it, everybody around you is going to get it. If you're happy and you're positive, it takes longer for that to be caught, but it can be. Events where you know you made a difference are going to help. Burnout, emotional exhaustion, depersonalization. This is actually the depersonalization is pretty high for physicians. For nurses, it is more of the fear that I can't make this different. It's a compassion fatigue fear that happens to nurses, but physicians relate it as emotional exhaustion. You become depersonalized, but not in the emergency department. I don't think this occurs, but I can tell you throughout the rest of the hospital where we have patients who are dying, all staff, physicians, nurses, chaplains, respiratory, all staff go into those rooms less than into the rooms of patients who are recovering. What is that about? Are we scared? of death and dying? Have we not addressed our own mortality? Have we not made peace with the fact that we actually are going to die? And we are. So should we learn from that? And I think there's some folks who've taught us a lot. Tuesdays with Maury. Anybody read that? Fabulous. Embracing and befriending death and dying can help us do a better job when we're with those who are dying. But it does produce burnout. It produces diminished empathy. Now, you know people who don't have any empathy. So what, that patient is so irritating. I don't want to take care of him. She really bugs me. She asks too much. Oh, that family is over the top. Now, you know them, don't you? Yeah, we know those folks. They are over the top. And we think, God, there's got to be a better way. If you have enough of them, you just have to take a break. I had a nurse I was presenting in Baltimore recently, and I had on this same topic, and I had a nurse say, well, I can't get out of the unit. Now, the people who smoke, they can get out of the unit. They get their smoke breaks. And I said, if the smokers can figure out how to get a break, my guess is you can figure out how to get a break. I mean, smokers get a break, so you take a non-smoking break. Have somebody cover your patients. And she said, oh, they just leave their patients. And I thought, and I just looked at her. I mean, I was in a whole room of physicians and nurses and social workers and psychologists, and I said, oh, I hope they don't just walk out. And I hope people don't, but everybody needs a break. Did you know that if you take a lunch break, you actually do better work? It's kind of like speeding. I learned this in our safety conference the other day. Really, speeding in your car, it doesn't get you there any faster. It gets you a ticket. And if you're speeding, you just have to brake more for those who are actually driving the speed limit. So you arrive about the same. So it doesn't accomplish anything. That's what I want to say for you when you're in the throes of things and you go, I don't have time. Take a minute. Take a minute. I can give you a 1-minute technique that'll change how you feel. I'll do it at the end. Burnout, withdrawing. It is different than compassion fatigue. The burnout symptoms are exhaustion, apathy. Compassion fatigue people are not apathetic. They are deeply sad because they feel like they have failed at their job and they want to keep doing it because they love it. There's a lack of interest. I just don't care. Now, I got to tell you, when I was in my residency, chaplaincy residency, I had a whole group of chaplains that I was working with, and they'd come in, they'd want to talk, and I thought, I don't want to talk about this. The interns, you know how that is. And I'd go, listen, here's a quarter, go call somebody who cares. Didn't want to do it. Sometimes you just can't do it. Go talk to your supervisor. I don't have it today. They didn't have it for me on occasion either, but that's okay. We have diminished empathy, we get irritable, and this is what causes them. Very different than compassion fatigue. Burnout triggers are caused by insufficient resources and disrespect and lack of pay, not feeling affirmed, and those poor boundaries again. It is necessary to have boundaries. My boundaries weren't good because I gave my physicians my home number, of course, and I kept my pager on. Nobody could do pediatric ministry like I could do it. I was sure of it. I was wrong. My docs would call me in. There was a trauma in the emergency department. They'd say, please, can't Ann come in? She is not on today. And they'd call me anyway. Or a baptism, a blessing that was needed. That was my fault, folks. I needed to teach those colleagues that I didn't want to debrief with very much how to do some of the things that I was doing. It was important. It was important work, but you just can't do it 24/7. I was a workaholic. I no longer am. I love Wake Forest for that reason. Wake Forest has encouraged good boundaries. It has encouraged lunch every day. It does encourage taking a break. We do have paid time off, which is meant to be used, not saved. I had a colleague that used to say, I'm so excited, I have 500 hours. I said, really? I may have 5. When I finally figured out I needed to take some time off, I said, what are you saving it for? Well, I might get sick. And I said, and you might not. It's a benefit. I left thousands and thousands of dollars at VCU, but it was because I wasn't sick. They didn't pay me for the sick time. And I'd used all the vacation time, so they didn't pay me any more for that either. But really, use your time. It's meant to be used. Employers actually give that to you as it's a benefit. It's actually not a right, it's a benefit. And it's a benefit for you to use. So if you are just worn out, better that you take a day and just take a day and enjoy it. Rest, sleep, read, go to a movie, whatever nourishes you, than to come into work and be grumpy and irritable and chew people out. It's just better. It's just better. Compassion fatigue versus burnout. Compassion fatigue can happen because of one single exposure, one horrific event. Burnout, insufficient resources is the number one. That crash cart is not where it's supposed to be. It's not stocked the way it should be stocked. When I put my hand out, I don't reach the piece I needed. Healthcare requires intentionality, not only in the work that we do and how we stock the places that we work, but in our own internal work, intentionally taking care of self and colleagues in order to be our best. And the American people expect us to be the best. We just expect it. I expect to go into a hospital where I am cared for and hope that I don't get a hospital-acquired infection. And it will make me mad if I do. I gotta tell you, and it makes others angry. You gotta care with intentionality to make this work. Burnout, the poor boundaries is important across the board, and that's something that we learn or don't learn. I had a nurse, I couldn't believe it. I finally said, you can't even take care of this patient anymore. She went on vacation with this family, pediatric nurse. Now, she should have known better, but she didn't, and it was not addressed. Therefore, if you do it and it's not addressed, it looks like it's encouraged or it's approved. That's not approved. When you become so personal with a patient, which causes additional fatigue, you actually can't care for that patient objectively. And so she loved this patient. He was cystic fibrosis. He had cystic fibrosis, and he was there. He was in our system all the time. And we said, you can't take care of him any longer because she's going to miss some nuances that are really important for nurses. Now, this is something that you can go online and get. It's called Professional Quality of Life Inventory. Just Google Professional Quality of Life. It is Beth Hudnall-Stam's Quality of Life Inventory. It's free. It's not a medical test. It's not a psychological test. It will help you to identify your potential, not whether you're there or not, your potential for compassion satisfaction, compassion fatigue, and burnout. The importance of knowing that is, are there places where I can grow and develop and change and benefits I can access at my system that will make me a caregiver that has higher satisfaction than potential for fatigue and burnout. So I encourage you to do that. We don't have time this morning, but it's a self-report, self-scoring that is easy to do. And if for some reason you you get that and you go, oh, I don't have any satisfaction and I look like I'm really fatigued and burnout's just on the next chapter, call me. We'll sit down and talk about it. Call your chaplain, call your psychologist, call someone in your system, your employee assistance program. Call folks that deal with this on a regular basis and sit down and talk with them. Because we can identify and be proactive rather than reactive. Professional quality of life, compassion, satisfaction, the good stuff, the really good stuff of caring, what we like, the altruism, that self-confidence that we get when we know we are good at what we do and we do it to the best of our ability. We want healthcare providers who are confident. I used to talk with families whose children were going in for surgery, and one of the surgeons one day was just in a really bad mood, and he was rude to the family. And the family was wanting to ask questions and really understand before their child went into surgery. And he said, well, if you don't trust me, I am not doing this surgery. And I thought, I'm just so glad I'm here today, sitting in this conference. So I talked with them about the necessity of a surgeon having enough ego strength to take your child into an operating room and operate. And that was what you were seeing today, was his ego strength. It was abnormal for him to be extremely rude every time, but we had dealt with this many times. And so I kind of calmed them down. Then I went to him and I said, really? This child needs surgery and you're debating on whether or not his family trusts you? They wouldn't let their child go in surgery with you if they didn't trust you. And it has taken me hours to help them understand your personality, that you have to have an ego strength that allows you to cut open a child. So he came back and he apologized to the family. I had a lot of clout in that system. It was important. Chaplains were important, and we really worked in areas that were intentional around how we cared for families, and I was just there so long they all knew me, and some days they were grateful I walked in, and some days they went, oh, she's going to get me on that one. Well, if you're guilty, you're guilty, you know? Compassion fatigue is the bad stuff of caring, and it happens to us, and we feel like we've burned out. It may be hopelessness, or it may be that you're simply worn out. That warrants taking paid time off. And secondary traumatic stress is that compassion fatigue piece that enters you. Compassion fatigue is on the inside. The suffering we take on because of the suffering of others. Healthcare providers go into healthcare because they want to care for people. They want to give good care. And we get burned out, or we are compassion fatigued, or we're morally distressed. And there are ways to turn it around. Self-care. Now, this is my favorite topic, self-care, because I am really good at mental, emotional, and spiritual. But if you look at this body and turn all the way around, it's actually 40 pounds lighter today than it was August the 2nd. It is Wake Forest Baptist. I'll just tell you, it's the weight management clinic. But I got to tell you, I wasn't sure that physical, mental, emotional, and spiritual really did have to be all integrated. And I figured out it really does. It really does. What makes the difference in whether or not we can really cope is our spiritual well-being and our skill development. But if we are not physically able to do things, it impacts the way in which we care. And if I don't love myself well enough to care about my physical well-being, I have a spiritual crisis. So I've lived with spiritual crisis a long, long time. I grew up in eastern North Carolina where we ate country-style steak, gravy, mashed potatoes, and peas and biscuits. Now, is there nutritionists in the room? They would just go, oh, you gotta be kidding. I mean, you know, it was that kind of food. Eastern North Carolina, you know, we lived off the farm, but we didn't cook that well, although my mom's cooking was great, obviously. You have to figure out, a lot of people in healthcare are really, really good at their physical well-being. You run, you walk, you lift weights, you really get into it. In fact, it becomes almost a spiritual exercise. But I got to tell you, we've still got to learn how to reflect on what has occurred, find blessing in every day, a blessing that we gave to someone else and a blessing that we received. We have to be intentional and mindful of what we're doing. Self-care is not about occasionally going to get a massage. It's not about occasionally going for a walk or taking a vacation. It's about being intentional and doing it every day. It is a discipline. And that discipline of physical for me was I had to be in charge and responsible for so much in all the other areas of my life. I thought, I don't want to do it. I just didn't want to do it. I do want to do it. And I do give lots of thanks to Wake Forest for that need that just kind of clicked in appropriately. Every day. That's why in trauma you do the pre-work, and it's important. That's why you have a system and you don't wait till things fall apart. It's every day. And when we do it every day, Our system, our psychological, spiritual, mental, emotional, and physical systems are ready to be present for the traumas that happen and the pain and suffering that we see. So I do think it's both philosophical, theological, and that those 4 domains have to be addressed. Self-care is what alleviates the compassion fatigue that we experience. And it is a daily discipline. But it is not just your responsibility. And that's where a lot of folks get tripped up, because people, Beth Hudnall-Stam did not want to use the word self-care because she said people will think it's all about them, that they have to do everything. Self-care is not only our responsibility. It is mine. It's my family's responsibility. It is my colleagues' responsibilities. And it is my institution's responsibility. If my institution knows that I am struggling, institutionally, we must address it. And that's what's happening. It has been happening somewhat for nurses, but it is beginning to happen for physicians as well across the nation. We must attend to that. Administrators must attend to that. So it's everybody's responsible. We get paid time off institutionally. We have colleagues. I hope you have really good colleagues who will come up to you and say, man, you're in a bad mood today. Is there something I can do? Or will walk up to you and say, I know things are rough, but taking it out on Roger is not going to make the difference. It's not going to change for you. It may feel momentarily good, and then you're just going to feel guilty that you blew him out of the water. So being able to speak to colleagues, having that much trust, that we have each other's back, that we care well enough, that we can say truth as we see it. And then our families. We model for our children, or not, what self-care is about. Now, self-care in my family was, Ann, you need some exercise, go hoe the garden. And I thought, that's not fun. Go weed the flowers. No, that's not it. And consequently, I learned that I don't like exercise. I still don't like exercise, but I do it, because now I know it's good for me. And both Dr. Ard, who's at Wake, and a physician from Duke recently said to me, oh, when you lose your weight, you're really going to enjoy it. And I'm hoping. I have faith. See, I have faith. And I'm hoping that that is a true statement, because it hasn't kicked in for 61 years. My PCP said, you know, if you'll exercise, endorphins will kick in. Never. I mean, I exercise and sweat. I don't even know what endorphins are, because they do not kick in for me. I think there must be something wrong with that system, but I am doing it. So all you Wake people, you make me accountable. You say, have you been out walking today? Have you lifted weights? You know, when you get 61, you cannot lift weights and lift yourself up out of a chair if you are as heavy as I have been. And that is not good. I told folks I've just learned about the physical piece, so because I got the other pieces in the first 61 years, I need 61 years in the physical piece. 122, that's not bad, is it? For a goal, for life. It'll be fun. There's a lot of responsibility in how we are doing. So don't claim it as, oh, I have to do this myself. I wouldn't have lost weight if it hadn't been for Jamie Ard and Michelle the nurse and Yvette the nutritionist and Will, my personal trainer, who is really tough, and the behaviorist. I mean, I needed a team. You know, you've heard you need a village. Well, we all do. And some of us need it for our spiritual care. Some of us need it for our physical. Some of us need it for how do you integrate all the pieces. It's not a negative. It's positive when we learn that we can trust others to help us. There are 4 components to really good self-care: physical, mental, emotional, and spiritual. Now, we've talked about the physical, those healthy systems and diet and exercise, and mentally reframing what we see. Anybody got a negative comment today? You thought, oh, it's so bad. Just anything negative. No? Oh, y'all were so good. Okay. I had a nurse that went to Loma Linda to a pediatric conference. She was in my study. She came back and I said, gosh, how was the conference? And she said, oh, I didn't learn anything new. I said, you didn't learn anything new? No, we're already doing all that. And so I looked at her and I said, so how does it feel to be working in an incredible, cutting-edge institution? And she looked at me puzzled and I said, if we're doing what Loma Linda's doing, we must be doing something right. That's got to feel good. When you go to a conference, generally, you either learn something new or you are affirmed for what you're already doing. So conferences are always beneficial. Now, if you're going just because you need something new, there's probably an edge inside of you. We want new stuff, but we also need to be affirmed for what we already know. Thinking critically. I have been in multidisciplinary rounds where I would say to a pediatrician, do you think this child might die in this admission? And John Mickle would look at me and he'd say, wow, Ann, yes, I do. And I said, does that change the treatment plan? And we worked as a team to think about what needed to happen. A surgeon, a heart surgeon, now really, I felt like I'd arrived at this point, the cardiac heart surgeon, the cardiologist for pediatrics. I was out in the waiting room planning a funeral for this 2-year-old. And he was in the unit cracking the chest again, massaging the heart. And I said, I don't understand, Dr. Durb. Why were you doing that? He said, I got so focused on that heart. He said, I wish you had said, why are you doing this? The family already knew the child was dying. The family had already come to that realization and was doing the work they needed to do of beginning that grieving process and that ritual process, but the team was not there yet. So it's a gift when a colleague can say, what are we doing? And just calm it down so that we can think more clearly. Emotionally, we need to be able to express our feelings without fear, joy, sorrow, and pain, and not think less of each other because we're not able to hold in those tears. I've stood with many, many pediatricians as tears roll down their faces because the teenager who got a heart transplant did not comply with the meds. And that second heart failed, and he was devastated. And the doctor walked over to a window and just stood, and tears rolled down his face. And I thought, I can't imagine the pain that he is in. He worked so hard for this child to have life. And sometimes it doesn't help. We don't change it. Spiritual connections. Spirituality is not about religious organizations. So let me just be clear. Spirituality is about meaning and purpose in life. It is about where you find your ultimate meaning and purpose in life. And when we are connected with ourselves, really know ourselves, deeper than self-awareness, really know who we are. When we are connected with others, so that I can say to Paula, how's that staff doing? I saw somebody in tears today. Can I come down and see them? When we are connected to something that is greater than ourselves, and you know what that is for you, then we are spiritually connected. And I will confess for clergy around the world, when things are stressful, and especially for chaplains, when we are busy, and families are sad and staff are sad, we don't pay enough attention to our spiritual lives. Now that sounds ridiculous, because chaplains ought to be worried about that or working on that every day. But we tend to eliminate that which we think, I've got to do this other piece, and I want to fix this for this family, and I know that they are sad, so I've got to suck it up, which is what nurses do when they get patients back to back, and physicians do when they get traumas back to back. We eliminate something because we can't manage it all. So one of the best lessons I learned in seminary was when everything is going bad, when you're grumpy and can't stand yourself, go take a nap. And I thought, that is good advice, because when you wake up, you feel better, and your perspective changes. So recognize when you're weary and not able to really function. Now, I expressed it one day when I got up late and was late running out the door, and I picked up the phone and I called my colleagues and I said, I am late. And it was not the day to be late. And I said to them, please don't even talk to me till after lunch. And I thought, what professional does that? Mostly we don't. But you know what? It was helpful. They didn't speak to me till after lunch, and I was better and they were better. That was sort of a rule in my family. My family didn't talk with me until after breakfast. They never figured out when I was a child I had sleep apnea. Of course I was grumpy when I got up. I hadn't been breathing half the night. We figured it out when I was an adult. So it makes a difference. Now I get up, I'm pretty happy. It's amazing what oxygen will do for you. If we do our best to integrate our mental, emotional, and spiritual and physical well-being, it becomes so much greater than all those individual parts. And we become the best that we can be and give the most that we can give within good boundaries. What is well-being? Positive self-concept, finding meaning and purpose in life, good physical health. See, it is there. I used to put that the last item on any presentation I was doing because it's my least favorite. And good emotional adjustment. It's not the absence of disease. It really is about how we choose to live our lives. It is about lifestyle choices. It is about preventing preventable diseases. And it's about a balanced life. And a balanced life has mental, emotional, physical, and spiritual components. Our employee wellness program includes financial in that, and I think I put my financial under physical, mental, emotional, and spiritual. It's all that for me. That's the next hurdle, being able to retire. It's going to happen. Evidence-based practices for physical massage relieves stress, and my hope before I retire is that health systems in the United States recognize that massage therapy for employees at no cost is a benefit return on investment. I think that if we had a massage therapist doing just chair massage in the ED on a regular basis, it would be calmer and we would decrease the chaos. I know we would decrease the tension and stress in ICUs because I've done it. Reflexology I love because it just is pressure points, and the first time I ever had reflexology, anybody experienced reflexology? It's feet, hands, and head. I had energy for 24 hours. I didn't even know you could have that much energy. It was great. It was great. Yoga, becoming aware. Now, I worked with a chaplain. Actually, he was director of pastoral care, and he taught yoga. But it took him years to figure out that it was also a spiritual practice, that it was both physical and spiritual. And yoga helps us to be mindful. It helps us just settle down and calm our bodies. And it is remarkable how we can lower the stress because we practice that. Exercise. Do something you enjoy. Now, I've told most folks at Wake Forest, I really like to kayak. You just can't do it that often. I need somebody to help me. I do need lifeguards out there with me. You know, I need people who can swim because I don't. But I do love the water. Diet. What works best for your body? Our bodies are not all the same. You know, it's not. A presenter on bullying one day, she said, it's just like food. You know, you don't have to be heavy. It's food in, food out. You don't have to bully. And I thought, it is not food in and food out. I have a colleague whose metabolism is so high that she loses weight while she sleeps. I gain weight while I sleep. And then I had a doctor say, yeah, that's right. It is about, it's not about food in, food out. A lot of it is, about 70%. But there's some other pieces. Then aromatherapy and the holidays. What do you smell at the holidays? What do you smell? Cinnamon. What? Pumpkin pie. And how does that make you feel? Good. It makes you feel good. Smells are good for us. And we have aromatherapy at Baptist, which is just terrific because it can change the way you are experiencing your day by smelling lavender or lemon. Don't you like to clean your house and just it smells good? Yeah. It makes us feel better. It's about well-being. Our mental well-being, it's really about how we're coping every day, how we're feeling. And it's whether or not we have positive self-regard and positive regard for others. If we have positive self-regard, we are almost always going to have positive regard for others. If we don't have positive self-regard, we will not always have it for others. Unless you're martyr or victim, those things happen. Evidence-based practices for mental cognitive restructuring, and we talked about that when just helping somebody look at a situation differently. That is the beauty of interprofessional education and multidisciplinary work, is that the whole team can put in all the data that we've got to make the difference for the best for that patient and that family. If a physician feels the total responsibility, he or she is burdened, and we burden them. And it's hard because ultimately they think, I am responsible. But the whole team can make a difference in the way in which we care for people. So use all the resources. Reflection. Gratitude practice. I have people do this, and I'd encourage you to do this week. Just 1 week. See what difference it makes for you. One blessing that you offer somebody a day. One good thing. One made a difference. One made a difference in your life. Something that happened to you or said to you. You know, we just try to get people to smile. You know, in the South, you think everybody smiles. Not at Wake Forest. We walk with our heads down. So I intentionally speak to people. I intentionally smile at them. Good morning, how are you doing? Makes them crazy. But still, they're aware that I know that they're there. Helping people every day with something. Journaling, that's a good practice. So do that gratitude. It's a practice I use in my research, in my interventions, and it turns the way employees feel about what they're doing. Just to think every day. And it doesn't take you 3 minutes. Actually, it wouldn't take you half a minute. Skill development. If you've got an employee who's really down in the dumps, nothing's right, it's always bad, send them to a conference. Skill development enhances people's sense of well-being. It's worth the money. Emotional well-being is, as we said, positive self-esteem. Enhanced emotional well-being really helps us with our performance and our productivity. Decreased emotional well-being is indicated with stress, anxiety, and/or depression. So where are you today? Stressed? Anxious? No? Good. Positive self-concept? Good self-regard? Yeah? Okay. And productivity. And I think we should put creativity in there. We are more creative when we feel good about ourselves and those we are around. These are the evidence-based practices for good emotional well-being. Crying. Can you remember the last time you cried? Can you remember the last time you laughed until you cried? Those are good. Tears are a gift to release the toxins in our body. The NICU director of nursing at VCU said, I'd say, Sharon, the memorial service is coming up. I'm not coming in. Sharon, I really need you to come. The parents want to see you. But you'll make me cry. And I said, no, I don't make you cry. You already have the tears. They're there. They need to be released. I just give you the opportunity. And sure enough, she would cry every time she came. But that also said to me she wasn't crying enough because it's painful and she didn't want to come back in. But generally, the reason it is because we haven't processed. Tears are not a sign of weakness. They are a sign of strength. To be able to cry with another is strength. Now, I know in nursing school for years and years and years, nurses were taught that they were not to tear up or cry around a patient. I want to say to you, it's perfectly okay. Now, if you become overwhelmed, go get somebody to take over your case. Go get somebody to handle that. But parents are not offended when you tear up. They know you care. It's a part of who we are. It says something about us. When you can't cry, I want you to worry about yourself and go find a good friend. Debriefings are important. Talk therapy or art therapy. I love art the best. I'm not an artist. I don't have any talent in that arena. But I do it anyway because I don't have to say anything. I can create. Nobody may buy it or like it, or I wouldn't sell it. But, still, be creative. And there's so many ways to do that. Social connection. When we are really down and compassion, fatigue, or burnout, you know what we do? We look at that cell phone and go, best friend, I just can't talk to her right now. No, it's my husband. I don't want to do that. Yeah, I have to leave a message. We don't answer our phones. We don't talk to people. And we are the most technologically obsessed people that I know. I've never seen a place where there were more cell phones, more iPads, more everywhere you are. I watch it in church now. It's hard to get still enough and quiet enough to be with the holy if we're on technology. Social connections. We usually steer away from them when we're compassion fatigued. It is the one thing you need. So when you're really, really down, when life just is yucky, call a friend, go to dinner, go to a movie, do something that supports your well-being. And then therapeutic music. I actually just learned music therapy and therapeutic music are not the same thing. Who knew? Music therapy is when you actually work with people with instruments. Therapeutic music is when you listen to music, like classical music, that changes the way you feel. I listen to country music. I like it. It tells a story. Now, it took Frank Tupper, professor at the Divinity School here, a long time to appreciate country music, that he was going somewhere in the country and he couldn't find any stations for country music, so he listened to it. And he said, they were not so bad. The theology was not so bad. And he came to Providence Baptist Church where I was serving on staff in Charlotte, and he preached about the value of country music to a group of people who believed in the classics. They were so offended. He got messages like, have you lost it? Really, I've never seen a congregation get so riled up over something like that. But he was just, and it is good. You gotta listen to some of them. Spiritual well-being. This is spiritual well-being. You'll notice there's not one word about religion in here. The courage to look within and to trust. A deep sense of belonging, of wholeness, of connectedness, and of openness to the infinite. It is the ability to give praise and ask for help. Now, I ask you, how many of you are good caregivers? And lots of you raised your hands. Now, how many of you are good at receiving care? Okay. Go to a different hospital. If you need something, don't come to Wake Forest, because we need people who actually want to receive care. People, if you are not good at receiving care, you are not as good at giving care as you think you are. The more we know how to say thank you and I need, the better we're able to anticipate the needs of others. That took a lot of years too, because people would say to me, oh, he did a good job, and I'd go, oh yeah, but if I'd only, if I had, and just downplayed it. And it took me years to learn to say thank you so much. Thank you. That's all the response that's needed. The ability to give praise and ask for help. That's a spiritual issue. I work with a nurse manager in pediatrics. She'd come to me and she'd say, oh, this is happening or this is happening. And I look at her and say, it's a spiritual matter. She said, Ann, everything's a spiritual matter to you. I said, everything is a spiritual matter. Everything's a spiritual matter. If you just, think about it. It's all about how we're engaging or not engaging, or being kind or not being kind. Spiritual well-being is essential for healthcare providers. Now, that doesn't mean that you are a Methodist or a Presbyterian or a Catholic or Jewish or Hindu. It means that somewhere in the center of your being, you have a sense of something greater than yourself, and you attend to it. Now, my colleagues would say it helps if you attend some body of people who really want to engage in thinking about the sacred. And I would say that too. But my sister said to me recently, I've got stories I could tell you that you wouldn't believe, but I'll say those for another conference. But my sister said to me the other day, she said, you know, Ann, I believe in God, but I don't think you have to go to church. She thought I was going to say, yes, you do, because I'm a minister. And I said, that's right, you don't. I don't think you have to go to church to believe in God. I think some of us choose to go to a faith community because it's where we belong, it's where we get nurture, it's where we get help, it's where we give help. It's about connecting. And that matters to me in my life. But it's true for me when I meet with the nurses or the physicians, it's about connecting. But I have to center myself well at least once a week. It helps me. And I notice when I don't. So just some thoughts. Evidence-based practices for spiritual. Breath prayer. It is my favorite because it takes no time. Now, some of you do it just as breathing, deep breathing. When we get anxious, I don't care who you are and how much training you have, we breathe from shallow, way up here, and we need to breathe way down low. We really need to take really deep breaths. Breath prayer for me, and I will just share with you how I do it, and I'm sure that many of you do something similar. Breath prayer was designed after what was an ancient practice. And when I breathe in, when I need to just slow myself, and this is what I have taught chaplain interns and residents through the years, is that breathe deep. You can run to that code, you can run to that death, but when you get to the door, stop and breathe. Breathe in, God of love, exhale, use me for good. I do that 3 times, and I taught staff to do that in the study, and that's how it decreased the tension in the unit and increased problem solving. It was fascinating how it changed, and it was just that simple thing. But for chaplains, I say your job is a non-anxious presence. So you're on the code team, and you go to the code, but your job when you walk in that room is to be so calm that you bring a calm to that situation. It's something they hadn't thought about because they had men in health care, they had men in they rush. It's an emergency. Well, it's all in the way you look at the emergency. So I encourage you, breathe deeply, use your sacred other if you have that. If not, just breathe. It is good for you. Meditation on a single word, yoga. I love this. Well-being isn't the absence of health problems or brokenness. Well-being is what you choose at the center of your life to do with these frustrating conditions. Renewal, rest, and reconciliation. Get some rest. Improve your spiritual well-being. Get out in nature, walk, see the flowers, smell the roses. Enhance your skill development. It will enhance your sense of who you are. And then coping will improve. It's the way we are created. Self-care, my job with a little help from my friends, I want to repeat. Self-care is personal, familial, collegial, and institutional. Remember that. When you just feel like you have nowhere to go, look at what the institution already provides. It's daily. It alleviates the compassion fatigue. And if we'll attend to it daily, it'll make a difference. Boundary setting, learning to say no. Do you often say yes to something that you wish you'd said no to when you get there? Yeah, every once in a while I do that. I used to do it a lot. I don't do it anymore because one of the things about growing up is that you learn to say yes to the things you want to do and no to the things you really don't want to do. And that's okay. Receive support from your peers, your supervisors, your organization. Know the triggers for compassion fatigue. respond to those symptoms and have a plan. Have a plan for what you're going to do. Learning to say no was really difficult for me because I almost always said yes. I still say yes a lot, but not as often. Stam, Beth Hudnall Stam, her challenge to each of you is to learn to transform encounters with these traumatic situations into opportunities for growth for ourselves and for those whom we seek to heal. And my challenge to you is to remember that there will be soulful fatigue on occasion, that it will engulf us in the intense and broken places of life, but hope does reside because of kind, compassionate, loving care offered by others through God's good grace. May you have a blessed and happy day. Don't you like, I had a colleague who said, don't say bless your heart. That's so Southern. I hope you have a bless your heart kind of day and that you do something that matters. Everybody needs 8 hugs a day for well-being. So find 8 people today. Give hugs and receive hugs. And not just little pats on the cheek kind of hugs. These are those frontal bear hugs. So find you somebody that'll give you a hug. Thank you very much.